Hi everybody, it's Dr. Magnifico from jrsfullvetandpobly.com. This is Daisy. She was just adopted about 2 days ago. She is a lab. She was bought by a family who found her and thought that they were buying from a private breeder. It's still a little up in the air as to where she came from. They did not see her with the rest of the litter. They did not see the mom and dad. They really, the breeder wasn't there when they picked up. So there's quite a few questions that we have about her history. She was playful on the first day they got her, and then she's been sleeping a lot and having diarrhea. So she is here today because they are worried about her, of course. The big kind of take-home important messages about her is that she is a very young puppy. So any puppy who is under 6 months old and it acts lethargic or has diarrhea really needs to go to the vet pretty close to immediately. These guys can really dehydrate very quickly, and it doesn't take a lot of diarrhea for that to happen. Thankfully for her, her temperature is normal. So the first thing that we do is check her temperature. The second thing that we do is we check her gums. She's of course got black gums, so it makes it a little harder, but she's pink. And then the next thing we do is check her hydration status. So I'm running my fingers along her gums and they're nice and moist, and then she doesn't have any tenting on her skin. They brought a fecal sample in, so any dog with diarrhea, especially young dogs, the first thing to do is check a fecal sample. I tell people all the time that puppies just come with worms, so you really should expect it. You should be seeing your vet with your new puppy within the first 3 days. Immediately, if your puppy is sick, you should be checking a fecal sample. That fecal sample should be going to the lab, and then appropriate deworming as that fecal sample provides. Any change in behavior, any change in activity level, so lethargy, vomiting, diarrhea, is going to the vet right away. Your vet's going to hopefully talk to you about, running a fecal test, starting the vaccines, making sure that they are up to date on all of their vaccines and that everything is appropriate with that, and then following up very closely. If she doesn't bounce back and improve very quickly, she's going to be admitted to the hospital. I don't give a lot of wiggle room for these guys because they're just too fragile. She has not been vaccinated for her parvo vaccine in about 2 weeks, so that's what I'm really worried about right now. That's also done with a fecal sample. I would say for today's visit, because she is otherwise she's alert and pretty healthy, that today is going to be sub-Q fluids. I'm going to start her on an antibiotic. We're going to send her fecal out. So the fecal's about $30. Antibiotics are about $30. Fluids about $30, and her exam is about $50. We're also going to microchip her. It's $10 at this clinic. Your black puppy looks like every other black puppy, so we want to make sure that's done as soon as possible. And then she is going to come back the minute anything changes, so if she gets worse, and she's going to be coming back every 3 weeks until she's at least 4 months old. She will go on monthly heartworm and flea and tick preventative too. But please don't delay with a sick puppy. Get to the vet right away. Thank you. Good luck, everyone. Bye.